If you're over 60, your medicine cabinet could be robbing your memory faster than time itself. By the time you finish this video, 20 more seniors will have been diagnosed with dementia. That's one every 66 seconds. But here's the part nobody warns you about. What if the real cause isn't getting older? What if it's sitting right next to your coffee maker? Here's what almost no one is talking about. New research tracking nearly 6 million seniors shows that everyday medications could shrink the memory centers in your brain by over 28% in under a year. The pharmaceutical industry has known this for decades, but they keep cashing in while millions of seniors lose their minds. Literally, I'm going to count down the 9 most dangerous everyday medications triggering rapid memory loss, ranked from commonly ignored to mind-destroying. Number 3 will shock you because it's prescribed to millions for something harmless, but it literally shrinks the brain regions you need for forming new memories. Education only. This is not medical advice. Never stop medications without consulting your healthcare provider. Before we dive in, tell me, what medications are you taking every day? Have you ever felt sudden brain fog or found yourself searching for words? Drop your answer below. Your story could save someone else's mind. Let's start with number 9, and don't let its position fool you. This pink pill is in almost every senior's medicine cabinet, and it might be scrambling your brain chemistry before you even realize what's happening. Number 9. Diphenhydramine or Benadryl. Odds are it's sitting in your nightstand right now. Millions trust this pink pill for sleep, allergies, or colds. It's cheap over the counter and looks harmless, but looks can be deceiving. But inside your brain, Benadryl is quietly disrupting the hippocampus, the area that stores new memories. It's part of a group called anticholinergics, which block acetylcholine, the chemical your brain needs to form memories and stay sharp. The older you get, the more your brain depends on every drop of acetylcholine. A landmark study published in JAMA Internal Medicine followed over 3,400 seniors and found those using anticholinergic drugs regularly had a 54% higher risk of developing dementia. That's more than half again the normal risk just from a simple sleep aid. The danger gets even worse if you're taking anything labeled PM, nighttime, or allergy relief. These are often just Benadryl hiding under a different name. As your brain ages, it can't clear these chemicals like it used to, so they build up and cause lasting harm. Here's what you need to do right now. Check every over-the-counter pill in your cabinet for diphenhydramine. For allergies, switch to newer options like loratadine or cetirizine. They don't sneak into your brain. For sleep, ask your doctor about safer choices that won't rob you of your memories. But things get even worse with number 8. This drug is marketed as gentle on your stomach, but it quietly blocks the nutrients your brain needs to stay sharp. Number 8 is proton pump inhibitors, commonly known as Prilosec or Nexium. These drugs reduce stomach acid and are prescribed for heartburn, GERD, and acid reflux. Many seniors stay on them for years because symptoms return when they stop. Here's the hidden danger. PPIs interfere with vitamin B12 absorption, a crucial nutrient that protects brain cells and supports memory. A massive study in JAMA Neurology examined over 73,000 people aged 75 and older. Regular PPI users had a 44% increased risk of developing dementia compared to non-users. By crushing stomach acid too aggressively, PPIs also block your body's ability to absorb magnesium and calcium, nutrients your brain cells need to talk to each other. Without them, your neurons misfire, leading to confusion and memory lapses that look just like early Alzheimer's. The problem goes deeper. PPIs increase levels of amyloid beta plaques in the brain, toxic proteins that disrupt brain function and drive Alzheimer's disease. Danish researchers tracking nearly 2 million people found PPI users aged 60 to 69 had a 36% higher dementia risk, especially with long-term use. Here's the twist. There are safer options your doctor might never mention. H2 blockers like famotidine work differently and are much less likely to mess with your mind. Even natural remedies like deglycyrrhizinated licorice can calm your stomach without putting your memory at risk. 7 targets a problem many seniors face but creates an even bigger one. Bladder control medications like oxybutynin, sold as Ditropan, help with urinary incontinence and an overactive bladder. On the surface, it seems practical. Nobody wants embarrassing bathroom emergencies. But oxybutynin blocks the same brain chemical as Benadryl, acetylcholine. and it crosses into your brain more easily than many other drugs. This makes it particularly hazardous for memory and cognitive function. A major study in the BMJ found that people over 65 taking strong anticholinergics like oxybutynin for more than 1 year had a 49% higher risk of developing dementia. That's nearly 1 in 2 people showing increased risk. The mental side effects are often blamed on aging. People feel foggy, forget appointments, lose track of things, or can't follow conversations. It's almost never linked to the bladder drug until the damage is already done. Here's what most people don't know. There are newer bladder meds that work in a totally different way. Mirabegron, sold as Myrbetriq, doesn't block acetylcholine and has far less impact on memory. These safer options exist, but too many doctors still reach for the old, risky ones. Before we move on, you need to hear this. Number 6 might be the most controversial of all because millions of seniors take these drugs to prevent heart attacks and strokes. Number 6 is statins, including simvastatin and atorvastatin, sold as Zocor and Lipitor. These cholesterol-lowering drugs are among the most prescribed medications worldwide for people over 60. Here's where things get tricky. Your brain is almost 60% fat, and cholesterol is crucial for building the protective coating around your nerves. If you lower cholesterol too much, you could be starving your brain of what it needs to work right. A study in Frontiers in Aging Neuroscience found that seniors over 70 on statins for more than 3 years had a 26% higher risk of mild cognitive impairment. High-dose users showed even more noticeable declines, with some reporting sudden memory loss, where they couldn't recall names, recent conversations, or familiar driving routes. But here's what most doctors miss. Not all statins hit the brain the same way. Some, like pravastatin and rosuvastatin, don't cross into your brain as easily and are safer for your mind. If you've been on a statin for years and notice brain fog or forgetfulness, talk to your doctor about lowering your dose or switching to a safer option. The key is balance. Don't stop statins. The key is balance. Don't quit statins out of fear, but make sure you're on the right type and dose for your brain and your body. It's one of the most dangerous traps. These drugs seem like lifesavers at first, quieting anxiety and helping with sleep. However, over time, they become something entirely different. Number 5 is benzodiazepines, including lorazepam, diazepam, and alprazolam, known as Ativan, Valium, and Xanax. They work by enhancing GABA, your brain's calming chemical that reduces overstimulation. A comprehensive study in the BMJ followed over 8,000 seniors for 6 years. Those who used benzodiazepines for more than 3 months had a 51% increased risk of developing Alzheimer's disease. The risk climbed even higher for long-acting versions like diazepam that stay in your system longer. What happens is a chemical sedation that slows your brain down. You stop learning as fast. Your mind gets less flexible, and confusion and memory gaps creep in. Seniors on benzos often say they feel disconnected or just not like themselves. The cruelest part is withdrawal. When you try to stop, anxiety and insomnia can be severe, making the drug feel essential when it's actually the source of the problem. Never stop benzodiazepines suddenly, as this can cause dangerous seizures. Work with your doctor to taper slowly and carefully. Alternatives like buspirone for anxiety or cognitive behavioral therapy for sleep can help you find calm without stealing your memories. If you're on any benzodiazepine, your next move is simple. Schedule a talk with your doctor this week about a safe taper. Don't suffer in silence and never try to quit on your own. There are safer ways to get your peace of mind back. 4 looks like a miracle pill that treats depression, pain, and insomnia all at once. But underneath, it's one of the most potent brain-disrupting medications still commonly prescribed. Number 4 is amitriptyline, sold as Elavil. This older antidepressant is still prescribed for nerve pain, sleep problems, and sometimes migraines. It seems like a versatile solution, but it blocks acetylcholine so strongly that cognitive effects aren't just possible. They're expected with long-term use. The massive JAMA internal medicine study I mentioned earlier found that people taking higher cumulative doses of anticholinergics like amitriptyline over 10 years had a 54% greater chance of developing dementia. The damage happens silently with no warnings at first, just a gradual decline that looks like aging but is actually drug-induced. Most people are never told their sleep or pain meds could wreck their memory. They start to notice short-term memory loss, trouble finding words, and a fog that just won't lift. Even small doses taken night after night can quietly erode your brain power. For nerve pain, alternatives like duloxetine or gabapentin may offer relief without the same memory risks. For sleep, melatonin or very low-dose doxepin has milder effects on brain chemistry. For mood support, newer antidepressants like sertraline are generally safer for cognitive function. Now, here's where things get really concerning. Number 3 is prescribed to millions of seniors for depression and anxiety, and most people think it's a modern, safer antidepressant. Number 3 is paroxetine, sold as Paxil. It's one of the most commonly prescribed SSRIs, and at first glance it appears gentler than older antidepressants, but here's what they don't tell you. Paroxetine is the only SSRI with significant anticholinergic properties, meaning it interferes with acetylcholine just like the other dangerous drugs on this list. A large review in Frontiers in Psychiatry examined elderly patients taking different antidepressants. Paroxetine users showed measurable declines in short-term memory, verbal recall, and attention span within the first 12 months. They were 30% more likely to show early cognitive impairment compared to those on other antidepressants. The irony is brutal. It's supposed to stabilize your mood, but over time, it chips away at your mental clarity and emotional balance. The fix is simple. If you're over 60, avoid paroxetine completely. Ask your doctor about switching to safer options like sertraline or escitalopram. They don't carry the same risks and are much easier on your brain. But nothing can prepare you for number 2. These drugs were made for severe psychiatric illness, but now they're handed out to seniors for simple sleep problems or mild agitation. Number 2 is antipsychotics, including quetiapine, risperidone, and olanzapine, sold as Seroquel, Risperdal, and Zyprexa. These powerful medications were designed for schizophrenia and bipolar disorder, but today they're frequently prescribed off-label to elderly patients for sleep issues or behavioral changes. The consequences are devastating. A comprehensive study in The Lancet followed more than 25,000 older adults and found that seniors prescribed antipsychotics for behavioral symptoms were 71% more likely to develop worsening cognitive decline within 12 months. The FDA has issued black box warnings because these drugs increase stroke risk, sudden death, and severe sedation, leading to falls. The way these drugs work is brutal. Antipsychotics crush dopamine, the chemical your brain needs for motivation, focus, and memory. When dopamine drops, your brain slows down and shuts off. Seniors can become dull, flat, or even zombie-like. Their personalities fade, and families are left mourning someone who's still right there. Many families aren't even told what these drugs do. They just see their loved one declining without knowing the cause is chemical, not natural. Always ask why an antipsychotic was prescribed and whether it's truly necessary. Behavioral symptoms can often be managed through structured routines, improved lighting, addressing pain, and enhancing sleep hygiene. What's your biggest worry about medications and memory loss? Are you concerned about something you're taking now, or have you noticed changes since starting a new drug? Share your story below. I read every comment and often reply with personalized advice. Now, we've reached the most dangerous threat of all. You might think it's a single drug, but the biggest driver of rapid dementia in seniors isn't just one pill. Number 1 is anticholinergic polypharmacy, the hidden danger almost nobody talks about. This means taking several drugs with anticholinergic effects at the same time. Picture this: a senior takes diphenhydramine for sleep, oxybutynin for bladder, and amitriptyline for pain. Alone, each might cause mild memory loss. Together, the damage multiplies fast. A massive analysis published in Age and Aging tracked over 280,000 older adults and found those with the highest anticholinergic burden had a 120% increased risk of developing dementia within 10 years. That's more than double the normal risk. Most seniors have no idea they're taking multiple anticholinergic drugs. When you block acetylcholine from all sides, your brain doesn't just slow down, it starts to decay. Neurons wither, synapses shrink, and your brain slips into a state that looks just like Alzheimer's. Here's the most empowering part of this entire video. Drug-induced dementia is often reversible. When the anticholinergic burden is alleviated, many seniors experience a return to clarity, energy, and improved memory function within weeks or months. The brain is remarkably resilient when given the chance. Here's your next move. Ask your doctor or pharmacist for a full medication review this week. Have them check your anticholinergic burden with the right tools. Once you know your risk, you can work together to cut out unnecessary drugs, switch to safer options, and give your brain a fresh start. This isn't just about avoiding harm. It's about taking back your mental sharpness when you need it most. Polypharmacy is dangerous, but with the right help, it's completely preventable. Let me give you the 3 most crucial takeaways to remember. First, anticholinergic medications that block acetylcholine are the biggest threat to senior brain health, especially when combined. Second, many common drugs, including sleep aids, bladder medications, and certain antidepressants, carry this risk, but safer alternatives exist for almost everything. Third, drug-induced cognitive decline can be reversed when caught early and addressed properly. The simple truth: protecting your memory after 60 is more about what's in your medicine cabinet than your genes. Small changes to your meds can add years of clear thinking to your life. Which of these medications are you currently taking, and will you schedule a medication review with your doctor this week? I want to hear about your experience and what steps you're planning to take. Next week, I'll break down the safer alternatives your doctor should be recommending instead of these risky drugs. If you want that guide, just comment "safer swaps" below, so I know you're interested. Remember, your mind is worth protecting, and you have more control over your brain's future than you realize.